In the next section, we're going to talk about some novel medication approaches that have been used in borderline personality disorder. The reason to do this really is to talk about some future directions that research is taking, as they may have important value for understanding mechanisms leading to borderline personality disorder. But none of these medications have sufficient evidence to really apply them clinically at this point. And there's a whole host of medications that have been tried, and we'll go through some of them in this section. Perhaps one of the most interesting is omega-3 fatty acids, such as eicosapentaenoic acid and docosahexaenoic acid, have been used in borderline patients. They've been some evidence they can decrease depression, suicidality, or affective instability. And recently there's been a meta-analysis that summarized across these studies using omega-3 fatty acids. And they did suggest that they can be helpful for the impulsive discontrol and the affective dysregulation in borderline patients. So they do have some promise when you're treating borderline patients. Methylphenidate has been used in borderline patients with comorbid ADHD. And they do suggest that methylphenidate can help with the ADHD symptoms, with motor impulsivity, anger, and depression. But one of the most interesting studies was by Prata and al. For borderline patients with comorbid ADHD, where they used methylphenidate while they were doing dialectic behavior therapy. And the important lesson from that was that the use of methylphenidate helped the comorbid symptoms and improved the patient's participation in the psychotherapy. And that often can be a useful role of using medications so the patient can take better benefit of their therapy, their schooling, their work. Clonidina has been used in borderline patients with comorbid post-traumatic stress disorder to try to reduce inner tension and hyperarousal. Prazosin and doxazosina have been used to try to control nightmares that you might find in a borderline patient with comorbid post-traumatic stress disorder. And memantina has been used for borderline symptoms in an early randomized controlled trial. And this is important because it's suggesting that there might be glutamate mechanisms that are involved in borderline symptoms. So it is trying to explore other possible pathophysiologic mechanisms leading to borderline personality disorder. Oxitocin has been studied for borderline personality disorder, and that's a neuropeptide that is excreted from the posterior pituitary. And of course, it's been found as a compound that can promote trust and cooperation and improve social cognitive abilities. And of course, it's of interest in patients with borderline personality disorder because we know that they have the deficits in their social cognitive function. They often have deficits in mentalizing, and they have a bias towards negative social stimuli. So it's certainly a compound of interest. To this point in time, there's no satisfactory clinical trials, but there is some laboratory experiments using oxytocin. And it's interesting that these laboratory experiments provide very mixed results. In some of the studies, they show improved hypersensitivity to social threats, so they're reading them more accurately. But in other situations, oxytocin promoted less cooperative behavior and less trust. These mixed findings are hard to understand, but one possibility is the social salience hypothesis. That is that oxytocin makes stimuli more socially salient, but obviously they can be salient in a negative or positive way, and that may be what happens to borderline patients. But suffice to say that oxytocin for borderline personality disorder is of great interest, but there really is no clinical role for the compound at this time. So the key points from this section is that these are medications under investigation for borderline personality disorder. They may be helpful in the future as they point to new pathologic mechanisms. For example, glutamate transmission may be important in borderline personality disorder. Omega-3 fatty acids are particularly of interest. They've been some evidence they can decrease depression, suicidality, or affective instability in borderline patients. Stimulant therapy can be useful for borderline patients who have comorbid ADHD. And the example given is you really want to pay attention to how much their functioning improves.